My name is Joshua Rovner from Progressive Spine and Orthopedics. We have a surgical practice where we treat patients with neck and back pain, and we typically see patients who have failed conservative management and are looking for long-term permanent solutions to their neck and back pain. We're often asked about what's new and innovative about spine surgery and what can be done to make spine surgery more effective with better results. And one of the things that's most innovative in spine surgery is robotic spine surgery. It allows us to do spinal fusion surgery more effectively and less invasively. And this allows better outcomes for patients and safer outcomes for patients. Today we're going to be answering some of the most common questions about robotic spine surgery. In spinal fusion surgery, we place hardware or screws into the spine, and these are placed very close to nerves and blood vessels. In the classic way that this is done, approximately 10% of those screws are in the wrong position, and that's even in the most experienced of hands. Robotic spine surgery decreases that complication tremendously. It allows 99% or greater accuracy in terms of placement of screws in the spine and improves the safety and effectiveness of spinal fusion surgery. The Mazor robot does not perform spinal surgery by itself. The doctor is there throughout the surgery, guiding all placement of all hardware. The robot simply shows us exactly where to place the hardware to be done as accurately and effectively as possible. The robot is simply a guide which allows us to do things much more accurately than without it. The main benefit of robotic spinal surgery is to prevent the common complication of misplaced spinal hardware. Approximately 10% of screws are misplaced in the spine, and that's even in the most experienced of hands. The Mazor robot allows us to place the screws extremely accurately. It guides our hands and allows us to place the screws with greater than 99% confidence, which cannot be done without the robot. There are no increased risks related to the robotic spinal surgery. The robot is sterilely placed on the operative field. It doesn't perform any of the procedure by itself. Everything is being done by the surgeon. It simply guides our hands. There are a few small pins that are placed in the spine during the surgery to place the robot on the spine, but this really provides no increased risk to the patient. If there is a technical problem with the robot, such as a power failure or a computer problem, the surgeon performing the surgery is more than capable of performing the entire procedure without the robot in the standard fashion. The portion of the procedure that's done by the robot is placement of the hardware. The robot guides the surgeon's hands and shows us exactly where to place the screws in the perfect position. This is planned before the surgery by the surgeon with the robotic software, and during the surgery, the robot shows us exactly where to place things accurately. Any decompression or removing pressure from the nerves of the spine is done by the surgeon, is not done by the robot. It's only placement of the screws, which is one of the most common complications of spinal fusion surgery, that's done by the robot. The recovery after spinal fusion surgery with robotic guidance is essentially not much different than without the robot. If we're able to perform the procedure in a minimally invasive fashion, because the robot helps us to place the screws more accurately, then this can decrease the recovery time after surgery. The Mazor robotic guidance system is cleared by the FDA and is being used in dozens of centers throughout the country. At Progressive Spine and Orthopedics, we perform our procedures at Hackensack University Medical Center, which is one of the only centers in the tri-state area which has the robot available to us. The reason that most surgeons don't use the robotic guidance system is because it's a relatively new technology and it's not available to all surgeons. We are lucky enough to be one of the few centers in the country that have access to a robot in our hospital, and as more robots become available, I think that more surgeons will be using it as it increases safety for their patients. Anyone who is planning to undergo spinal fusion surgery may be a candidate for robotic spinal surgery. There's really no reason that would prevent someone from having robotic spinal surgery if they're having a fusion surgery. Health insurance coverage for robotic spinal surgery is not an issue. There's no extra charge for it. It's covered by the hospital and it's part of the spinal procedure, and there's no extra charge to the patients. The only extra preparation for robotic spinal surgery is a CT scan that's done in a special center, which will be ordered by the surgeon prior to robotic spinal surgery. We have done many cases with the Mazor robotic guidance system. We've received special training directly from the manufacturer and have extensive experience with this device. We've had great results and are using it whenever possible to increase the safety of our procedures with our patients. We have had tremendous feedback from our patients about the Mazor guidance system. Our patients tell us that they have much more peace of mind going into surgery, and they're able to recover better after surgery because they have the peace of mind knowing that the screws were placed extremely accurately, and they don't have to worry as much about a complication after surgery.